Hello, everybody. Welcome back to another episode of Pre-Med Radio. My name is Neela Bandla, and I am the host of this show. Today, I am joined with Sophia, who is going into her sophomore year of high school. How are you doing today, Sophia?
I'm good. Thank you so much for having me.
Of course. And today, we're going to be talking about chronic illnesses in youth populations. So, my first question for you, Sophia, is what are the most prevalent chronic diseases in youth populations today, and how do they compare with previous generations?
So, when we think previous generations, let's look at like the mid to late 1950s. Okay, so this would have been when my grandparents, right, were growing up, young adulthood, so they would have been about our age, right? The most prevalent chronic diseases back then were primarily infectious, and then the lasting effects from those infectious diseases. So you can think polio, tuberculosis, smallpox, right? These would have left you with maybe blood diseases, permanent lung scarring, physical deformities, right? I know polio sometimes could cause stop growing in one part. So, but then 70 years ago, right? It's been a lot of time and we have pretty good technology now. So you can think with the development of new vaccines, the specific research targeted more towards kids and adolescents that have been completed. So all of these have led to technological advancements, meaning that most of the chronic diseases that affect youth populations now
Mhm.
are primarily non-communicable. So these fall under the categories of neurodivergence, mental illness, genetic diseases. So think more like ADD, ADHD, autism, asthma, prediabetes. Obesity was officially recognized as a chronic disease in around 2008, which I think is really interesting.
Yeah, absolutely. And with these non-communicable diseases, how do you think, like, can you think of any examples on technological advancements that helped us sort of stop having these non-communicable diseases as being classified as chronic illnesses?
hmm So you can think about let's think about maybe multiple sclerosis or various autoimmune diseases, right? Multiple sclerosis is maybe a bad example, but if we think about autoimmune diseases with a lot of immune blockers, sorry, my English, with a
No.
lot of immune blockers, you're able to help stop the effects. So if you think about maybe hyperthyroidism with the removal of gluten, right? This is new research that has come out that's helping, right? I don't want to say remove, but definitely
Yeah.
helping make these diseases hopefully a thing of the past in the coming years.
Yeah, absolutely. Um, so how have advancements in healthcare altered the way or the process, the way we go about these chronic illnesses in youth populations?
So there are two things I want to cover here. And I think one of the most important ones is increased interconnectivity. So, right, with more research coming done, more studies being completed, all of this new information that we have specifically on youth populations, right? Because kids aren't just pediatrics isn't just medicine in miniature, and I'm sure I'll cover that later, but it's really interesting because children experience different effects, right? So a 12-year-old with the same disease as a 43-year-old are not going to experience the disease to the same impact, to the same volume, to the same magnitude. So advancements in healthcare, again, specifically research and interconnectivity between doctors, the more doctors and physicians and researchers that are able to work together means that we're hopefully able to, moving forward, treat more case specific.
Yeah, absolutely. So with that, obviously with technological advancements, there comes like the good and the bad, not only with doctors, but also with patients. So sort of what kind of lifestyle choices, especially just keeping technology in mind, what lifestyle choices affect the chances of adolescents getting chronic diseases?
Excuse me. So I
Yeah.
think for this one, we can cut it into kind of conscious and unconscious slash influenced lifestyle choices. So for conscious, you can think about, I mean, right, phone addiction and fast food culture is becoming more and more popular, I want to say. So, I mean, right, my parents didn't have phones where they could sit and scroll
Yeah.
on Instagram Reels for 3 hours a day on the couch, you
Yeah.
know? And conscious choices are going to be abstaining from using drugs, alcohol, smoking, vaping, right? All of these, I mean, they have pretty well-known carcinogens in them.
Yeah.
And right with vaping, you hear about popcorn lung, the chronic lung scarring, right? That's not a good thing. You don't want to have it.
No.
So, I mean, choosing not to vape, choosing not to smoke, choosing not to partake in like dangerous activities like this for your health are pretty important. You can also think unconscious slash influence choices, right? So if my father has been a pot smoker all my life, right? I'm making this up, but you're more likely to be influenced into doing drugs and making choices like that when you're older.
Thinking about these chronic illnesses, such as, and you just mentioned, like it can be generational, those lifestyle choices can be generational. Going back to how they compare within previous generations, how do these lifestyle choices, are they different with per generation and like what the generations, like as teenagers, what they exhibit, what activities they do, and everything like that?
So I think when we think about generational, right, two things come into mind. So influence, right? I kind of talked about if you are surrounded by people who partake in whatever activities, right? Whether that's riding your bike 10 miles a day, right? That's obviously a positive influence on your health. Or choosing to eat McDonald's twice a day, right? That's obviously going to have a negative impact on your health long term. But I think peer influence is also a large part of it. The people you choose to surround yourself with. I mean, it sounds silly to say, but you become the closest people that you hang around.
Hmm.
And I mean, I think you need to be somewhat selective as far as peer influence because, right, it's like, oh, she's just a friend. Like, these are just the people I'm friends with, right? Like, we just hang out once a week. But you become these people, and if they're making poor choices that can have effects on your long-term health, I definitely would say that has an impact on your chances of developing chronic disease.
Yeah, absolutely. So, let's shift towards the pandemic. The COVID-19 pandemic happened around 5 years ago. And so, how did this COVID-19 pandemic affect children with chronic illnesses?
So I'm not going to pretend even for a second that the pandemic was easy on anyone, right? I think we all felt some effects, right? Whether in our mental health or in our physical health or how we felt or went about our day to day, right? It was something that no one in the world had gone through before, right? No one really knew what was happening. It was a time with a lot of insecurity, right? No one knows what's happening, right? When will I be able to see my friends again? When am I going to be able to go back to school? When will it be safe to in-person grocery shop? When can I go back to physicians?
Hmm.
Right? So can you imagine for these children and adolescents who are already struggling with long-term chronic disorders, especially mentally?
Hmm.
Anxiety and depression are pretty easy to think of, I think, for this one, right? They're pretty
Yeah.
well known. You can somewhat imagine the effects. So, the decreased social connectivity, right? You're being cut off from people. If you're young, you might not have a way to keep in touch at all besides seeing each other in person.
Hmm.
It caused larger feelings of instability and worsened a lot of symptoms. But if we shift to thinking about physical disorders, right? Autoimmunity is a good one, right? People with immune disorders or immune deficiencies long term were often forced into higher levels of isolation and quarantine, even than anyone else, right? It was shown that these people are at a higher risk of developing the virus, but they were experiencing it at much higher, like way more severe.
Yeah.
So that means increased symptoms, right? It sounds morbid, but a higher likelihood of death, even, right? We didn't have, I mean, in the beginning and even still now, some of the treatments remain not lacking, but there's definitely room for improvement across all fields. So when they were forced into higher levels of isolation, right, they're so closely interconnected, your mental and physical health, that they had effects on all areas of health.
Yeah, absolutely. And with those, when we're talking about mental and physical chronic illnesses, do you think there's almost a pattern with people who have chronic illnesses to also have had developed depression and anxiety during the pandemic?
hmm I think we can shift this question even to not entirely pandemic specific.
Yeah.
If you have either a mental or a physical illness, you are at a much higher likelihood to develop the other, right? So if we imagine a 17-year-old male with depression, right? That's going to affect his ability to be able to take care of himself, do day-to-day grooming tasks like showering, shaving, to make smart decisions about food, to be able to, get out of bed, let's go to the store, let's go see a friend, right? This is in turn going to affect his physical health over time. And we
Hmm.
can think of it vice versa too. Okay, so let's imagine maybe a 14-year-old female, right, who's struggling with a physical disease, the way she feels about herself, the way she manages her time with her friends, the way she understands herself and her illness, right? They're going to directly impact each other.
Yeah, absolutely. And with that interconnectedness, how do mental illnesses and physical illnesses present differently within the youth specifically? And how is that, especially with that connection?
Mhm. So if we think youth to adult, how they present differently, it's a hard question to answer because the way children, like I said, understand themselves and their illness, right? This is how my body feels and this is why, right? They might not know that, oh, my heart, I have an atrioventricular block, so oh, my heart isn't going to beat perfectly all the time. That's why I feel dizzy. So
Yeah,
in turn, the way that they communicate this, right? Oh, my elbow hurts. It's a sharp pain and it goes away from time to time, right? It's hard to know unless you can, through physicians do testing and put concrete data on it. It can be hard to know.
yeah, absolutely. And I also think that can also come within a big form of mental illness, because in that it's not physical, like it's
Mhm.
not a physical sign. Um, so why has the prevalence of chronic illnesses in young people increased by nearly 30% in the last 2 decades?
This is a really interesting question because, right, you hear 30% and you're like, wow, this is a huge number. Is this really happening? Or 30% more of the population? Like, is that really happening? That's crazy.
Yeah.
But I think when you hear a statistic like this, it's really important to keep in mind the context, right? So you said within 2 decades. So if we take it back to 2005, right? I wasn't alive. I'm not sure if you were alive,
I
but
was
clearly some things have changed. Clearly, some things have changed from then to now. So, if you think about all the technological advancements, right, we can see even within our lifetimes how much the iPhone has changed, right? My mother had, it was like this big, it was a square, it had like two buttons on it, right? All of that has changed. So, if you think about the sedentary lifestyle, and I talked earlier about even the rise of fast food culture, right? This unhealthy food, it's not great to have 4,000 calories for lunch, right? No shame, but like that's not an amazing lifestyle choice.
Yeah.
So I think when you hear things like this, right, I talked about culture a little bit. And then if we think about increased, like widespread information, right, through the use of the internet, it was around back then. It feels
Mhm.
so crazy to say, but they definitely had the internet. But if you think about, right, I can send a text to my friend in Australia in 10 seconds. Like, how crazy
Yeah.
is that? So these teams of doctors who can say, I have a patient presenting with these symptoms. Do you know anything about this? And
Hmm.
ask doctors around the world or doctors that they might not have a chance to talk to so often with these technological advancements, which I feel like it all comes back to that. It's kind of funny to say,
Yeah.
but are able to connect with new teams of doctors, new researchers to find more information and present more accurate diagnoses.
Yeah, absolutely. And I think there's just also, as you mentioned, there's an uptick of technological advancements and an uptick in research being done. So what are some treatments for children with chronic illnesses and how may they differ for an adult?
So, like I said earlier, pediatrics is not just medicine in miniature, right? So it's really important to remember. I mean, even I feel like I talk about this a lot. The way children understand themselves and what's happening in their body, they have a much lower level of autonomy of choice, right? Adults have the ability to say, oh, I'm not sure I want to treat it like that. The treatment symptoms seem so terrible, or I'm not willing to go through that. It'll take away my family time. So children don't have this luxury, right? You're a minor. A lot of times your legal guardian, parent, family members are making these choices for you. But for adults, right, you have the ability to say, oh, I'm busy that Tuesday. I can't have that transfusion done. Things like this, which impact, right, depending on how often you're able to get treatment or what your treatment is in general, right? It's incredibly case specific.
Mhm.
So a child who's 12, maybe in Alabama, is not receiving the same treatment for a child who's also 12 living in New York, right? It's
Yeah.
case specific.
Yeah, absolutely. And that brings me to my next question. When it comes to differing areas and places, comparing to United States to other countries, what are some similar and different ways that these respective countries go about chronic illnesses within their youth populations?
Okay, so let's focus on three countries. We can talk about the US, France, and China. Okay. So in the US, we have a mix of public and private healthcare, which leads to health equity and inequity, right? The treatment that you're available to receive based on zip code, who you are. I mean, systemic racism. I feel like that's a really big topic to dive into and absolutely not mine to talk about. But the treatment that you're able to receive and face with, the information that you're given from doctors, right? It could be intentional, right? What they're telling you based on what they think you might want, things like this. But it also leads to higher medication costs, which affects, like I said, who is able to receive what treatment and when. So that's a huge part of it. But if we compare that to France, right, and Europe, France has implemented policies and various goals. Their main goal is to provide free and universal healthcare to all citizens,
Yeah.
which leads to France has a much lower chronically ill population than we do. So if we look about, I mean, within the whole population, right, not even focusing on youth, I want to say the US is pretty close to 50%. I think it's in the high 40s. But
Hmm.
if you compare that to France, only about 16.6% of the population reports chronic illness, right? That's a crazy number, and the censuses are finding that they don't report any lower quality of life, right? People with chronic disease aren't reporting a lower quality of life than individuals who are chronic healthy, right?
Yeah.
And then if we shift that to China, right? We have a country in Asia for a nice little spread around the globe.
Hmm.
But the leading cause of all disability in China is mental disorders, right? So I talked a little bit about ADD, ADHD, autism, depression, anxiety, right? All of these things tie into sedentary lifestyles. One of the things I found really interesting when I was preparing for the interview was sedentary lifestyles and phone addiction are large problems in China, along with the level of activity that you're encouraged to do day to day.
Yeah. Yeah, absolutely. And with that, um, because a lot of this is obviously controlled with government. So depending on how the government is doing all of the, for example, the United States, we obviously have a government who is promoting and supporting a mix of private and public, while in France, we have a government that's supporting universal. So how do you think that governments could affect or help people, more specifically the youth population with chronic illness?
So I feel like when you talk about the youth population, a lot of times these aren't kids that are making conscious choices or, right? They aren't oftentimes the one bringing income to their families, but that decides what physicians they can see, what areas they can reach for treatment, right? All of these things for various diagnoses. I think personally, this is obviously a really intricate question.
Yeah.
Personally, I feel like focusing on lowering the level of inequity in healthcare, right? If more people are allowed to receive the same care, right? That's better than a lot of people would be getting now.
Yeah.
So I think that's what I would say.
Yeah, absolutely. And I think that's very applicable specifically to the United States. I mean, I live in the United States, and so I see it like the mix
Mhm.
between public and private can really expand that inequality. So my last question for you is, what are some other aspects of a child's life that may lead them to develop the chronic illness?
I think I can divide this one into three categories, right? So you have socioeconomic, which ties pretty closely into what we were just talking about,
Yeah.
genetic, and lasting medical procedural related. So let's get into socioeconomic. We talked, I think, a little bit about the zip codes, right? If your zip code, it's been shown that richer zip codes with access to cheap, clean food and water, right? Laundromats, right? Social connectivity, right? Zip codes where you're encouraged to get outside and get physical activity. Zip codes that have access to emergency medical units and good hospitals and good treatment, right?
Mhm.
These are all showing lower levels of chronic illness than zip codes where maybe it's dangerous. So kids aren't going outside to see other people and to go to new areas, right? Zip codes where you don't have access to quality food or water. Maybe you live pretty remote, so you're not able to have access to these things, but that includes access to clinics, hospitals, and trained doctors. So I think that's our first one, socioeconomic and the disparities specifically. But if you think also about genetic, right? Genetics obviously aren't a lifestyle choice, right? I was born with what I have, you were born with what you have. You can't really change that. So if you're born genetically predisposed to various diseases, such as maybe Parkinson's, hemophilia, color blindness, I know, various heart disease and physical deformities, right? You can't really change that. That's kind of what you got. And
Yeah.
then lasting procedural slash medical. So, God forbid something happens, right? But if you're in an emergency and maybe you're in a car crash and you need treatment right then and right now, you can be left with lasting impacts from these, right? Maybe even if it's something so small as like blood pressure, low or high blood pressure. But you can also be left with I know people who have respiratory stomas, right? That's chronic, right? You have
Yeah.
damage to your trachea, you have that for life, you know?
Yeah, absolutely. And I think obviously it either there's a lot with that, and then also just a lot of the time with chronic illnesses, there's all obviously the genetic diseases that you can't really change.
Mhm.
Thank you so much for letting me interview you today. This was a great interview and very educational for how chronic illnesses are presented in a specific group of people.
Of course, thank you so much.
Of course.